Welcome to Physytek podcast, where we explore fascinating interaction between technology, physical therapy, and wellness.
Hello guys, my name is Prince and welcome to the second episode of Physytek. Today I'm joined here by a lovely guest, but before we come to the guest, let me introduce my co-host, Alima.
Hi, Prince.
How's it been?
It's okay, it's going. We're trying. How's it going, I say?
Great, the heat is coming down,
It's coming down for you.
It's coming down for me.
Okay,
So.
that's good to
The winter
hear.
is doing it. I mean the Hamatan.
Okay, so what do we have here? What are we going to do today?
Well, she needs no introduction. You've seen her in the first episode, but today we have here again Gabby, and today is a bit more about Physytek, the whole organization, and what actually Physytek is. There's more to it than just the podcast. We spoke about telehealth and other stuff. So today she gives us all the
full
the
gist,
details.
yes,
all
and
the
you get
gist.
to know more about her as an individual too.
Yeah.
Yes. Alright guys, so we told you we will bring you nothing but the best, nothing but more education, more insights about Physytek and everything that we do. So today here we've already introduced our pretty lady sitting here, who you've seen in our previous episode. She is back again to give us more details about herself and about Physytek. So welcome back once again.
Thank you, Alina.
All right. So before we get into Physytek, I want you to tell us a little about yourself, who you are, what you do. Give us, some information to take home.
I'm Gabriel. I'm a physiotherapist. I have about half a decade of experience in this field. But I'm particularly inclined to musculoskeletal and sports physiotherapy.
Oh, interesting. We don't find a lot of women in sports, do we?
No. I work in White's gym and we don't have a female physio.
Really?
Not even we have a female coach. There's just one. So you can imagine. A lot of women in sports.
Okay. So do you do anything about aside physiotherapy?
Yes, I do. I love sports. It's kind of be in the field, but I do love sports. I love tennis. I love table tennis. I love football, maybe because I find myself in that field.
But you are in a football team or something?
Yes, I work with footballers.
Oh,
Yes.
I see.
She's been too kind,
Yeah, if we are allowed to give our own information, we are not allowed to say it ourselves. So we are kind of like holding back.
Yeah.
But there is more. I'm trying to get it out of there for you. So don't worry. She will say it before she leaves here.
For now, all I can say is that I work with a football team. But aside that, let's just leave my work and then the sports field. I love to interact with people. I love to study life. So anything that's got to do with life, knowing about what constitutes a human being, what they are made of, the deeper understanding of life, I would like to research into it. So I sometimes read, most of the time when I find myself not doing anything, or I just hang out with friends, family. Yes, that's what I usually do.
No, that's nice. So
Yeah, you already spoke in the first episode how it came about whole Physytek, but then I want you to maybe talk about it a bit more for viewers who are not familiar with you yet.
Well, thank you very much. Physytek serves as a pioneering solution here in Ghana and Africa, where we are trying to provide solutions, advanced technology solutions to our treatment methods in the physiotherapy field, and even in some of the health sector, some areas in the health sector as a whole. Some few years back, during COVID era, that was how come I started thinking about how we could bridge the gap between physiotherapists and the patients. Because most of the things that we do in our traditional way of delivering care to our patients, it has to do with physical touch and the manual techniques. So how do we then deliver the same treatment and solution to patients whom we couldn't see or we couldn't touch.
Okay.
So that's how come the whole idea about physical therapy and health came about. However, after researching, I realized that it was out in the Western world. So I asked myself, why not develop something like this
Yeah.
here in Ghana?
I mean,
So that was how come the first group of Physytek started. That was Monitor My Rehab. I think I'm in the shirt now.
I can see that.
Yes,
I was
yes.
wondering.
I was about to ask, you know. Yeah.
Yeah. So Monitor My Rehab was the first company that stemmed from Physytek, and it's a tele-rehab solution. So there's a whole structure to it. I'm going to explain it later.
Okay. That's interesting. So it means COVID brought something good to us after
Yeah.
all. If not for COVID, we wouldn't be talking about doing physio without touching patient, because our job is all about touching, holding, moving. So I think this is a great idea. This is very innovative. It's going to help us as physios and help our patients a lot. So how far gone are you? Like, where have we reached with the whole Physytek? Is there more to come? Are we done? Are we now starting? How far gone are we?
Well, there's a whole lot for the vision of physiotherapy. And I'm very excited that I'm not the only one doing this. I have my group, my team members helping me out. And that's how come we introduced our first team in the first episode. And to the viewers, I'd like you all to know that they are also part of the team. They're not just hosts. They are actively involved in making sure that Physytek is what we want, what we envision it to be. So how far are we? There are sub companies, as I said earlier, and then we have fully developed the tele rehab.
Nice.
Yes, and then we are in the process of getting the facility. I'll explain more. And then the hospital management system is almost done. So that's how far we have. So the hospital management system, it's an electronic health system where we usually do our record system, we analyze all the data in it, and also structure most of the things that we want to do with the hospital system, the hospital itself.
So it's not like a building.
No, so there's the building as well. So I would want to describe the structure later.
Oh, okay. Sure. All right.
Yeah. So you spoke about solutions for like management as well. So Physytek is not all about just patients. It means other therapists can also enjoy certain features of.
Yeah, so Physytek itself is a team, is a company that envisions to empower individual well-being using technology. Okay. So that's what Physytek will be doing. However, under Physytek, we have other solutions that would cater both health professionals and patients.
Oh, okay.
Yes. So with that, we are looking at ways by which, let's say, physiotherapists, doctors, specialists could reach out to their patients and deliver quality healthcare service with accurate results through technology.
So it's just like the patients being there and you, the therapist or health professional, being there, but you're not there.
Yes, some aspect of it does that.
Okay.
Some aspects also can allow you have your patients with you, but then you're going to use technology to get accurate diagnosis and the results in your treatment.
So that's just a step further from what we already do in our various hospitals. Yeah. That's nice.
That's nice. Mm-hmm. So how many solutions have we come up with so far? Like what was in there or what's coming next?
So thank you very much for this question. So that gives me the opportunity to describe the structure of Physytek. Mm-hmm. So there are 3 companies under Physytek. Okay. So the first one is Monitor My Rehab. That's like my baby. That was the first solution to what we wanted to do. So Monitor My Rehab is a tele-rehab solution. It comes as an app. It's a web app and then a mobile app. So you can have it on your iPhone or your Android phone. And what it does is that you can have sessions with your clients. So a therapist and a client, a doctor, a client, a psychologist, a client, dietitian, client, using a virtual platform. Oh. So you have a virtual platform where you can record have a live session,
Okay.
just like we have some video sessions.
Yeah.
Yes, so you can talk to your patient, or the patient can talk to you, the clinician, ask questions, assess the person, let the person move in various angles, um, measure it, and then you arrive at your diagnosis based on the things you ask the person to do. So that's one aspect. Further, it also allows you to record whatever findings you find from it. So you have a whole documentation page where you can
So like a
put everything in
folder.
a folder. There's
Okay.
something like that there. And then lastly, you have the treatment that you have to administer to them. So you have, for we physiotherapists, mainly use exercises.
Yeah.
So you have variety of exercises depending on what you want to administer to your patient, and then you prescribe it. But there's one thing that I'm excited about the whole Monitor My Rehab
Tell
MMR
us.
Tell us.
is the ability to monitor the patient's progress.
Oh, really?
Yes, it can do that. So what it does is that when you, after prescribing the exercise to the patient, now when the patient records, when the patient views the exercise, you, the therapist or the clinician, gets the opportunity to see that, okay, my patient has viewed the exercise.
Oh.
And if the person plays it to a certain point, the patient, you also get a feedback.
can
Oh,
choose.
okay. So yeah. So it's like you're seeing what the person is seeing, literally.
Yeah, not exactly, but then you know they did it.
You
because
know
they
they,
viewed
because
it.
they view this.
Yes.
Okay.
And then you can also make them record themselves whilst they're doing the exercise.
So then they can't just forward it to the end.
And
just
yes,
No.
yes.
So you can also decide to tell them, record whatever you're doing. That's if I'm not watching you, then send it to me and then
Okay.
I can view it.
Later.
Yes.
Oh, that's
Yes.
it.
Or you can decide that, okay, I'll use a live session to watch them.
Okay.
So maybe do squats, do push-ups, and I'm watching you.
Okay.
I can correct some few things. So that's what Monitor My Rehab is about.
All right. So it has been interesting. Thank you so much, Gabby, for
Thank you
coming.
very much, Alima.
We really appreciate you coming, and thank you again, my co-host. It
Yalla.
has been nice having you as usual. So I have been your host with,
Prince?
and I am Alima. See you same time next month. Bye. Next episode,
Bye.
actually.